Welcome to our webinar on how health can affect your wealth in retirement, brought to you by FedAdvantage. We're glad you can join us here today. True or false? Medicare will cover all your healthcare expenses in retirement. True? False? Unfortunately, this is false. Although Medicare will likely be your primary resource to help pay for healthcare, you will still have to pay for premiums, copays, and deductibles, as well as items like eyeglasses, hearing aids, and dental care, which Medicare does not cover. We'll take a closer look at Medicare later in our presentation. Consider this pie chart, which shows the percentage of spending by consumers aged 65 and older relative to after-tax income. The data comes from the 2020 Survey of Consumer Expenditures, published by the Bureau of Labor Statistics. Healthcare is the third highest expense category, behind housing and transportation. This slide breaks down that 14% healthcare segment even further. According to the BLS survey, Americans aged 65 and older spent an average of $6,833 on healthcare expenses in 2019. The vast majority of that figure went to paying costs associated with health insurance, including, of course, Medicare. Next question. How many people do you think have tried to calculate how much they might need in total to cover healthcare costs? Have you done so? If you haven't, don't worry, you're not alone. Only about 40% of people aged 45 and older have tried to figure out how much they might need to cover out-of-pocket healthcare costs in retirement. Even if you haven't yet performed the calculations, I'm going to ask you to take a guess. How much do you think you'll need to spend on healthcare out of your own pocket over the course of your retirement? More than $50,000? More than $150,000? What about more than $250,000? If you answered more than $250,000, you're probably in the right ballpark, depending on your health and marital status. According to the Employee Benefit Research Institute, a 65-year-old married couple in fairly good health who were receiving comprehensive Medicare and Medigap benefits in 2020 would need about $270,000 to have a good chance of covering just their premiums and prescription drug costs in retirement. It's important to note that these estimates are for total healthcare costs spread across the entirety of your retirement. So if you believe there's no way you can accumulate the amounts prior to retirement, don't panic. That's why we're here today. The key point is that health-related expenses you will face could consume a sizable chunk of both your income and assets in retirement. So our goal today is threefold: to examine 5 factors that can affect healthcare costs in retirement, to review the primary resources available for managing those costs, and to identify steps you can take to help manage out-of-pocket costs. Let's start with the first one: identifying some of the factors that can affect your healthcare costs in retirement. Perhaps, and not surprisingly, one of the first factors you'll need to consider in assessing your healthcare costs in retirement is your own overall health. Another is, of course, your age. Inflation is an important consideration, as is your gender. And finally, where you live may also come into play, depending on the types of healthcare services you need. Let's look at each of these factors in a little more detail. First, let's consider your general health and your spouse's, if applicable. Healthcare costs can vary considerably based on an individual person's situation. According to the Centers for Disease Control and Prevention, the leading cause of death and disability, including heart disease, diabetes, and cancer, are also the nation's leading drivers of healthcare costs. You'll need to consider the cost of medications and treatments associated with these, and other common considerations associated with aging, like arthritis, if they apply to you. So that's why your individual health circumstances are among the first factors to consider when projecting how much you might spend on healthcare during retirement. Now on to our next factor, your age. As you age, the more you could spend on healthcare. And even if your basic expenses don't change much, inflation will certainly impact the costs associated with them. So in your planning, you may want to factor in a regular increase in healthcare spending. As you can see here, healthcare costs, as represented by the orange bars, have generally risen faster than the overall inflation rate in recent years. Next up, gender, which may come as a bit of surprise. Gender is important because women, on average, outlive men. As you can see here, a healthy 65-year-old man who retired in 2020 has a 53% chance of living to age 85 and a 32% chance of living to age 90. A 65-year-old woman, on the other hand, has a 64% chance of living to age 85 and a 43% chance of living to age 90. For this reason, the estimated total out-of-pocket spending for a single, healthy, 65-year-old male Medicare beneficiary who retired in 2020 is $16,000 less than that of a single, healthy, 65-year-old Medicare beneficiary that's female. The point here is that women may need to plan for a longer retirement and therefore higher healthcare costs. Perhaps another surprising factor related to health spending is where you live. That's because health-related costs can vary considerably from one state to state. For example, the national median annual cost for a semi-private room in a nursing home is about $93,000, but the median annual cost in the New York metropolitan area is about 50% higher than that. In addition, because Medicare Advantage plans and prescription drug plans are offered by private insurance companies, their cost and availability can vary from one state to another. Now that we've considered just some of the factors that can affect your healthcare costs in retirement, we'll shift gears to review the primary resources available to help pay for those costs. A few folks may have access to retiree health insurance through a union or a current or former employer, or may have access to subsidized care through an organization, such as the U.S. Department of Veteran Affairs. But for the vast majority of individuals, Medicare will be the primary source of health insurance in retirement, so let's start there. Keep in mind that Medicare is complicated and your choices are plentiful. This selection is meant to present a basic overview. Medicare is the federal health insurance program that covers most people who are age 65 and older. It is composed of different parts that help cover specific services. Original Medicare is divided into hospital insurance, Part A, and medical insurance, Part B, which are run by the federal government. Medicare Part C, or Medicare Advantage, and Medicare Part D, prescription drug coverage, are provided by private insurance companies approved by Medicare. For more information, visit medicare.gov. Medicare Part A is basic hospital insurance. It covers services associated with inpatient care in a hospital, a skilled nursing facility, and a psychiatric hospital. It covers charges to the room, meals, and nursing services. It also covers hospice care and home health care, but does not cover long-term custodial care. Medicare Part A is a premium-free for most people, but deductibles and coinsurance costs apply to some services. Medicare Part B helps cover other medical care, including inpatient and outpatient physician care, lab tests, physical therapy, and ambulance services. Medicare Part B also covers 100% of the costs of many preventative services. Everyone pays a monthly premium for Part B. Although most people pay a standard monthly premium, those with higher incomes may pay more than this amount. Beneficiaries need to meet an annual deductible. After that, they pay 20% of the Medicare approved amount for most services. This table illustrates basic costs for the original Medicare program in 2021. Each year, Medicare will use the modified adjusted gross income reported on your tax return from 2 years earlier. Part A is premium-free if you or your spouse paid Medicare payroll taxes for at least 10 years. If not, the $259 monthly premium would apply if you paid payroll taxes for at least 7.5 years, but not 10 years. The $471 monthly premium would apply if neither you nor your spouse paid payroll taxes for at least 7.5 years. The annual Part A deductible is $1,484 in 2021. The standard Part B premium is $148.50 for single filers with a modified adjusted gross income of $88,000 or less, and married joint filers with a modified adjusted gross income of $176,000 or less. For those with higher incomes, the Part B premium ranges from $207.90 to $504.90. The Part B annual deductible is $203 in 2021. Note that there are no out-of-pocket maximums for Medicare Parts A and B. Medicare Part C, also known as Medicare Advantage, offers an alternative to original Medicare. Part C plans are provided by private, all-in-one healthcare insurers that contract with Medicare to provide the same benefits that Part A and Part B offer. Some plans offer extra coverage for expenses not covered by original Medicare, such as vision, hearing, and dental costs. Most Part C plans also offer prescription drug coverage that follows the same rules as Medicare Part D plans. Several types of Medicare Advantage plans may be available, including Health Maintenance Organizations, HMOs, and Preferred Provider Organizations, or PPOs. With an HMO plan, you generally must receive care and services from providers in your plan's network. PPO plans will have a network of healthcare providers. You will pay less if you use providers in your network. There is a separate monthly premium for the Medicare Advantage plan in addition to the monthly Part B premium. There may also be additional co-payments or co-insurance costs. All original Medicare beneficiaries are eligible to join Part D prescription drug plan, which is offered by private insurance companies or insurers that have been approved by Medicare. Premiums covered brand names and generic drugs, and out-of-pocket costs, deductibles, co-payments, and co-insurance vary by plan. If you are enrolled in original Medicare Parts A and B, you have the option to purchase Medicare Supplement Insurance, or Medigap. Medigap is sold by private companies that have been approved by Medicare and is designed to cover the deductible and co-payments that original Medicare doesn't cover, thus helping fill the gaps. Medigap insurance will not pay for procedures that are not covered by Medicare and does not cover prescription drugs. Coverage will vary depending on the benefits outlined in each specific policy. If you are enrolled in a Medicare Advantage plan, you cannot enroll in Medigap. This graphic summarizes your main options for getting Medicare coverage. You can choose to enroll in Original Medicare or Medicare Advantage Part C. Each has advantages and disadvantages, so you'll need to compare costs and benefits. If you choose Medicare, you might also add prescription drug coverage and Medicare supplement insurance. If you're within a year or two of your 65th birthday, you'll want to familiarize yourself with Medicare enrollment rules and deadlines. Although these rules are beyond the scope of this presentation, you can find more information on the Medicare website at www.medicare.gov. You might also visit the Medicare website to learn more about your options and to get information about specific plans available in your area when you are ready to enroll. We mentioned briefly that Medicare covers limited stays in a skilled nursing facility, but does not cover long-term care. Given that fact, now might be an ideal time to take a closer look at long-term care and the potential costs. It's hard to face, but the fact that our health might decline someday. But statistics suggest that this risk is greater than we think. According to the Department of Health and Human Services, someone turning 65 today has a 7 in 10 chances of needing some form of long-term care services. Many of us probably know someone who's had to rely on loved ones to help them cover the cost of basic care and everyday living expenses later in life. So perhaps it's smart to expect the best, a long and healthy retirement, while planning cautiously and realistically for that 70% chance. What exactly is long-term care? Long-term care refers to the ongoing services and support needed by people suffering from a chronic health condition or a physical or mental impairment. There are 3 levels of ongoing care. The first level of care is skilled nursing, which is generally round-the-clock care provided by professional healthcare providers such as nurses, therapists, and aides under a doctor's supervision. The next level of care is intermediate care, which is nursing and rehabilitative care provided by healthcare professionals, but on a less frequent basis than skilled nursing. The third level of care is custodial or personal care, which is often provided by family caregivers, nurses' aides, and home health workers who provide assistance with what are called activities of daily living, such as bathing, eating, and dressing. This is the most common type of long-term care. All three levels of care can be provided in many different settings, including your own home, an assisted living facility, or a nursing home. But the most pertinent question for today's discussion is, how expensive is long-term care? Let's consider the type of long-term care that is likely to cost the most: nursing home care. As we mentioned earlier, according to recent figures, the national median cost for a semi-private room in a nursing home is $93,072. But for our purposes, we should probably consider what that cost might look like in the future. If nursing home costs rise every year at an average rate of 4%, the cost of a nursing home care could reach nearly $204,000 by 2040. It's easy to see how the high cost of long-term care can threaten or even wipe out your retirement savings and jeopardize any assets you may want to leave to your children or grandchildren. Some of you may assume that Medicaid, which is often confused with Medicare, will pick up the tab for long-term care. Although that is indeed possible, there are many rules associated with who can qualify for Medicaid. Medicaid is the joint federal-state program that many nursing home residents rely on to pay some of their long-term care expenses. Medicaid is the largest public payer of long-term care services in the country. In some states, Medicaid also covers some home health care costs, a trend that will likely continue as states look for ways to contain Medicaid nursing home expenditures. But here's the catch. To qualify for Medicaid, you have to either be poor or become poor. You will have to use up most of your savings before you even qualify for Medicaid. And aside from a small personal needs allowance, you will have to use all of your retirement income, including Social Security and pension payments, to pay for your care before Medicaid pays anything. And once you qualify for Medicaid, you'll have little or no choice regarding where you receive care. Only facilities with Medicaid-approved beds can accept you, and your chances of staying in your own home are slim unless your state's Medicaid program covers home health care. How poor do you have to be to qualify for Medicaid? Each state establishes its own limits under federal guidelines, so eligibility rules vary. But all states count income and assets when deciding who qualifies for Medicaid. In most states, you won't qualify if you have more than $2,000 in countable assets if you're single. The limit is generally $3,000 for a married couple when both are applying for Medicaid. The term assets generally means anything that has cash value, savings, investments, and real estate, for example. If you're married, your spouse will be allowed to keep much more. Some assets are exempt from these limits, but just because an asset is not counted by the state when determining whether you qualify for Medicaid doesn't mean that it will never be touched. The laws in your state may allow a lien to be placed on your home or other assets at the time you qualify for Medicaid, so the state can recover part of what it's paid out in, Medicaid benefits after you or your spouse die. Make sure to consult an experienced elder law attorney if you need help understanding Medicaid's rules. Ultimately, however, the objective is to remain financially independent for as long as possible so you won't need Medicaid. And that brings us to the final part of today's goal, identifying steps you can take today to better manage out-of-pocket costs down the road. The first step that could lead to a better outcome is maximizing the amount you set aside for retirement during your working years. Many of you are likely earning the highest paychecks of your careers or approaching those peak earning years. If so, now is the time to take advantage of higher paychecks to ramp up your retirement savings. This means really putting your thrift savings plan or TSP to work. A key point to consider is that once you reach age 50, you can take advantage of what are known as catch-up contributions. For example, in 2021, participants in TSP can contribute as much as $19,500 per year, and those who are age 50 and older can contribute an additional $6,500. If you can't afford to save the maximum amounts, try to save at least enough to take full advantage of FERS contribution matches. All FERS employees receive an agency match equal to 5%. Not doing so is foregoing free money. If you don't have access to a retirement plan at work, already contribute the maximum and would like to invest more, or would like to diversify your investments beyond what's offered in your employment plan, you can use a traditional IRA. The only requirement for opening and contributing is that you have earned taxable compensation of at least the amount you contribute IRA account holders can contribute as much as $6,000, while those age 50 and older can save an additional $1,000. If neither you nor your spouse has access to an employer-sponsored retirement savings plan, you can contribute to additional IRAs are generally fully tax deductible regardless of your income. However, if either one of you participates in an employer-sponsored plan, the tax deduction for traditional IRA contributions is partially or fully phased out at specific income levels. This table summarizes the 2021 income phase-out limits for deduction purposes. They are generally based on your modified adjusted gross income. If you plan to use assets in a traditional tax-deferred retirement plan to pay your healthcare costs, you'll also have to factor in the taxes associated with those withdrawals or find additional resources to cover the tax obligation. Here's a simplified example. You need $7,000 in 1 year to pay your healthcare expenses, and you're in the 22nd% federal income tax bracket. You may need to withdraw $8,540 from tax-deferred accounts to cover the taxes as well. To help alleviate this concern about taxes, you might consider Roth 401ks and Roth IRAs. Although Roth 401ks and Roth IRAs offer no upfront tax benefit, the main advantage is that qualified distributions are tax-free. Unlike traditional IRAs, Roth IRAs are not subject to required minimum distributions during the original owner's lifetime. The only requirement for opening and contributing is that you have earned compensation that is at least equal to the amount you contribute and your income falls within specific limits. Roth contribution limits are the same as traditional accounts and will be aggregated with any traditional account contributions you make in a given year. That means if you make $12,000 pre-tax contributions to your traditional 401k account in 2021, you can make an after-tax contribution of only $7,500 to your Roth 401k account. To be qualified, a Roth distribution must come from an account that meets the 5-year holding requirement, and it must take place after age 59 and a half, or result from the original owner's death or disability, or meet another IRS exemption. You can withdraw contributions made to a Roth IRA, not earnings, tax-free at any time. That means you really don't have to wait 5 years if you need some of that money you've already contributed. Eligibility to continue to a Roth IRA phase out at higher income levels, as shown on this slide. The amount you can contribute will be reduced if your income falls within the limits as shown in the second column. If your modified adjusted gross income reaches the limits in the third column, you are not eligible to contribute to a Roth IRA. These 2021 income phase-out limits are based on your modified adjusted gross income. Another possibility for tax-free income is a health savings account, or HSA. If you have the opportunity to save through an HSA, consider taking the maximum advantage of it. HSAs are specifically designed to help you manage healthcare costs, both now and in retirement. They allow you to set aside money on a tax advantage basis, specifically to cover healthcare costs. You can only establish and contribute to an HSA if you are enrolled in a high deductible health plan, are not covered by someone else's health insurance plan, and cannot be claimed by someone else as a dependent. HSAs benefit from what is now commonly referred to as the triple tax advantage. First, your contributions are made on either pre-tax or tax-deductible basis. Second, account funds grow on a tax-deferred basis. And third, withdrawals used for qualified medical expenses are tax-free. Although most people view HSAs as a way to pay current medical bills, many folk are quickly discovering the benefits of using HSAs to set aside money specifically for healthcare costs in retirement. The reason is that HSAs offer the opportunity to invest in long-term vehicles with growth potential. HSA funds are yours to keep even if you change jobs. Health savings accounts are subject to annual contribution limits. These are the limits for 2021. One of the benefits of an HSA is that tax-free qualified withdrawals can be used to pay qualified healthcare expenses you may incur in retirement and that original Medicare won't ever cover, including dental care, eyeglasses, hearing aids, and improvements you may need to make to your home to accommodate health-related issues. HSA contributions and earnings may or may not be subject to state taxes. You can also use your HSA dollars to pay premiums and copays for Medicare Parts A, B, and D. However, you cannot use HSA dollars to pay Medigap supplement insurance policy premiums. For more information on the types of expenses you can pay with HSA money, refer to IRS Publication 502, Medical and Dental Expenses. Here are a few additional points to know about HSAs. Once you reach age 65, you can make withdrawals from the account without incurring a tax penalty. However, withdrawals used to pay non-qualified expenses, that is, non-medical expenses, are subject to ordinary income tax. After you enroll in Medicare, you can no longer contribute to an HSA. The third step you can take now is investigating other financial products and strategies that may help you manage the potential long-term care costs you may face down the road. Finally, perhaps the most important thing you can do is manage your healthcare costs in retirement, now and in the future, is to be mindful of your own health. This means exercising regularly, eating right, minimizing stress, and staying connected, either in person or virtually, with friends and family members who contribute to your overall well-being. Thank you for coming to How Healthcare Can Affect Your Wealth in Retirement, brought to you by FedAdvantage. I commend you for taking the initiative you've shown in wanting to improve your financial future and build a successful retirement. Should you have any questions about the materials discussed today, please feel free to visit our website at www.fedadvantage.com or send us an email at info@fedadvantage.com.